Good morning, beautiful souls. It's Dr. Danny. It's time for another Jeep Chat. So, what I want to talk about today is a concept called bodily autonomy. That's right, control over the body. This topic comes up in medical education. I remember it vividly. We had an entire week of ethics and discussion forums before graduating. And it's interwoven throughout the medical curriculum. And there's some other jurisprudence sort of concepts that are important when you're practicing medicine. But one of them is basically bodily autonomy and patient autonomy. So what does that mean necessarily? So for those of you that have ever gone to the emergency room or had surgery or established care with a new doctor, they're going to have you sign all these forms, check all these boxes, initial by certain statements. And a lot of that is typical just to be in compliance with the government. But a lot of it is you consenting to certain medical treatments. So just signing it just to get in, make sure you know what you're signing. Because what you're doing is you're giving permission for the people in that office or that hospital or that emergency room to perform procedures and treatments on you. Well, so let's say, for example, and the biggest one that we run into a lot is the Jehovah's Witness. Now, I'm not getting anybody down, but the people that follow that faith typically will not consent to blood products because of their religious beliefs. And so when they come into the hospital, when they come into an emergency situation, they have to make that known because the providers taking care of them don't want to inadvertently give them blood products or some other human product against their religious beliefs. So that's one example, but it really comes down to a bigger concept to sort of know what is going on when you're receiving medical care. Now, a lot of people don't know this. A lot of people just kind of walk in and say, hey, doc, fix me, sign, 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 and we have all these things done. And they can do things like urine drug analysis. They can give you blood. They can put needles in your arm to start an IV or to give you other medications. But every time a nurse, well, so let's say you're admitted to the hospital. Let's say you have a problem, something's going on. And a nurse comes in and she hands you some pills. You have every single right to ask and question what it is you're receiving and why you are receiving it. You have every right to do that, even if you've already signed those documents. So, for example, they hand you a pill and you don't want to take it. Well, doctor's orders, you should take it. You still don't have to take it. Did you know that? Yeah. So you have every single right when you are in the company of a medical practitioner, even after you've signed the consent forms consenting to any kind of necessary and appropriate treatment, you can still ask questions. You can still say, excuse me, what is that? Why are you giving that to me? And you can do research to see if it's something that you need to do. So I think it's really important for patients to take responsibility for their body, for what they're consenting to be done. You know, I'm going to kind of bring up an old wound, and that's the COVID-19 pandemic. There was a lot of issues around that because there is a area of study called public health. Sounds wonderful, doesn't it? Oh yeah, when I was in school, I even thought about doing an extra year just for public health because, you know, public health is important. You're out there, you're getting out information, you're educating the public so that they understand, you know, the treatments that are available to them. But at the same time, public health is precisely the discipline of study that was the reason for the shenanigans around that pandemic and how our public health officials, our government officials reacted, because public health is sitting in all these meetings. They don't actually see patients, they just do studies. Well, some of them do, but they sit in these meetings with government officials and they say, oh, okay, well, we need to tell everybody not to be near each other. We need to tell everybody that they need to do this and that they need to do that. And so it almost becomes authoritarian, right? So they recommend these things, and then government officials are in a position to make rules for you on how you take medicine, on what you allow into your body, and what you're quote-unquote required to undergo. So vaccines are a big issue with bodily autonomy, for example. Because when you, let's say you just don't want a vaccine. Now, 20 years ago, people would look at you and go, oh my gosh, no, don't do that. You know, don't say no. You should do it because, you know, if you don't, you're going to kill people because you're going to be infected and you're going to infect everybody else. This whole thing is crazy. Okay, but nowadays, after that whole COVID-19 pandemic, people are going, wait, my body, my choice, right? I mean, you know, it's my choice. Maybe I want this vaccine. Maybe I want to feel better. Maybe I want to feel good that I'm protecting the people around me and that I'm, you know, so people, if they want it, they should be able to get it. But at the same time, if they don't want it, you know, and they have sound, maybe scientific evidence that they have done the research on and they do not want it, then they should not have to have it. And so it's bodily autonomy. We have to stand up for that. It plays out in the most subtle and sometimes sinister ways. So bodily autonomy is a big deal. If you guys don't want certain things, you don't have to have it. Now, it brings up other issues of responsibility. So when you come to the medical system to ask for and receive medical care, there's an implied consent also. So let's say you're in a car accident, you're obtunded, and you don't have any awareness. That's different. We're going to do, if you present in an unaware state and your body is in shock or trauma, we're going to do everything to you to help you. That's just it. We're going to poke you, prod you, put you in imaging. We're going to do surgery if we have to keep you alive if that's your wish. So sometimes it's a good idea, guys, and this is an uncomfortable topic, is to make your medical wishes known somewhere in some form of documentation. So that if, for example, you are in an altered mental state or you can't make decisions for yourself, you have someone that is available to make those decisions for you. They're called a power of medical attorney. So you definitely want to do that. The other thing you also want to make sure, just to protect yourself, is, you know, do you want to end up on a ventilator? If there's no hope for you and you're being kept alive, what are your wishes? I know these are uncomfortable topics, but you actually have to think about these things. So think ahead, you know, what would happen if I was in a situation where I couldn't make decisions for myself? What decisions would I like to be made for me so that my wishes are carried out? These are just things we want to think about. So that's one issue of responsibility with your healthcare. The second is the concept of leaving a medical facility against medical advice. So let's say, for example, you're under my care and I recommend a plan of treatment. It is absolutely your choice to say, no, ma'am, actually, I'm going to leave. I'm going to go home. So you can do that. You can leave the hospital against medical advice. You're not in prison. We are not going to keep you there. We are not going to make you stay. We're not going to call the cops if you leave either. But there are consequences to this, okay? So, number one, if you have insurance, the hospital is going to notify your insurance that you do this, that you leave against medical advice. And so the potential for you to have that coverage taken care of might be diminished because of your decision to leave. So making responsible decisions with this power is also a big deal. So you want to make sure that you're absolutely okay with the consequences if you leave against medical advice. So yeah, so those are some of the options that we have. This is how it kind of works. Another interesting topic that a lot of people don't know about is that when you engage a private practice doctor, they also have the right to terminate their relationship with you, right? Yeah, most people don't know this. This is super interesting. So, for example, let's say you come into the office of a doctor and you sign all these consent forms. You say you're going to agree to do these certain things, and then the office is going to agree to provide you with this treatment. There are conditions to that. Like, number one, you got to show up for your appointment. If you don't show up, then you need to let the office know, because potentially you could be charged for not showing up. And also, if you are not complying with the treatment that's been laid out for you, that physician can send you a letter and say, we are no longer in a doctor-patient relationship. And you don't want that to happen, because that's hard. Doctors are hard to find. A good doctor is hard to find. And so again, it's another issue of responsibility. this is an area that's not talked about with people. People are not taught this when they're growing up on how to engage with the medical system. A lot of people actually sort of are under the assumption that medical care is free too, and it's not. We all pay for it. Whether it's whoever pays for it, it's being paid for. You have to pay for all the supplies. You have to pay for the medications. You have to pay for the nurses, the clinical care technicians, the unit health coordinators, the secretaries, the security guards, the maintenance for the building, all of that. All of that has to come from somewhere. And so it's not free. Even if you show up to an ER, if you take an ambulance, they're going to bill you at some point. Now, the interesting thing is if you are billed for a medical service and you can't pay for it, they are not allowed to take you to bankruptcy for that. I think that's one of the rules in our country, is you can't be bankrupt because of medical services. So there's a way to negotiate. We may talk about that in further Jeep chats, but I just wanted to open your minds up a little bit to how the medical system works as an insider and as someone who's interacted with it for, 15 years. Some of the things that I've encountered. So just remember, you have rights, but you also have responsibilities, okay? So, all right, guys, I gotta go in and do the thing. So I love you all, and I'll talk to you later. Bye.